My name is Andrew Hajduczek and I'm a bariatric surgeon. I'm a board-certified general surgeon and fellow of American College of Surgeons. I'm also a regular member of American Society of Bariatric and Metabolic Surgery. I started doing bariatric surgery first in association with most experienced surgeon around '96, and gradually it evolved into my main specialty, which it is now for quite a few years. Bariatrics name evolves from Greek baros, which is weight, and iatros, which is a physician or a doctor. So basically it's medical management of excess weight, and started in early '60s and over decades evolved through several procedures. Right now the most popular procedures in US as well as all over the world are Roux-en-Y gastric bypass, adjustable gastric bands, which is lap band and realized band, and for the last few years vertical sleeve gastrectomy. There are a few other procedures that are not as commonly used. Bariatric surgery helps patients lose weight by several mechanisms. First is restriction, which is the main mechanism for gastric bands, and it's a significant mechanism for Roux-en-Y gastric bypass as well as sleeve gastrectomy. Basically forcing people to take smaller bites, chew them slowly, make sure they swallow first bite before they go to the next one, and as a result they eat much slower, which fills them up and satisfies hunger better with much less amount of food. So it's a mechanism number one. Second mechanism is malabsorption, which is a significant part of gastric bypass. And a third mechanism is a ghrelin effect. It's a hormone produced mostly by mucosa, lining of upper part of the stomach, that by disconnecting it in a Roux-en-Y gastric bypass from a passage of food or eliminating by removal in vertical sleeve gastrectomy results in a dramatic drop in ghrelin hormone in a bloodstream, which as a result eliminates stimulation for the brain hunger centers, which basically eliminates that aspect for great majority of people for a significant amount of time. With in case of gastric bypass, ghrelin effect lasts for at least a year or two before it eventually kind of wanes off gradually. Since major problem related to morbid obesity are comorbidities, as a result of weight loss due to bariatric surgery, there is also dramatic resolution or at least very significant improvement in comorbidities, and those typically in relation to morbid obesity are type 2 diabetes mellitus, hypertension, hyperlipidemia, hypercholesterolemia, as well as obstructive sleep apnea, arthralgias of weight-bearing joints, swelling of ankles, and quite a few others typical conditions, practically all of which either improve very significantly or sometimes almost miraculously disappear quite quickly. Well, obviously, it's an operation, and even though it's commonly done, it's still a fairly major operation, especially gastric bypass and sleeve lap band to a lesser extent, where some complications are possible, so patients are worried, especially hearing some horror stories over the years from different locations. They are afraid of complications and possibly even death, a rate of which, however, is about 0.03%, meaning about 1 in 300 or more patients across the country, which includes mortality within 30 days, which usually, if it happens due to pulmonary embolism. Obviously, in-hospital mortality is almost unheard of, and we haven't had any. Well, Tri-City became one of the first bariatric centers of excellence several years ago, which basically means there is dedication on part of management as well as nursing staff and all ancillary personnel to accommodate and give best service to bariatric patients. The greatest benefit of having bariatric surgery done in a hospital versus surgery center is having all ancillary support and all services that are at hand when something is more difficult than was expected, and that may include anatomical anomalies that are discovered intraoperatively that prolong operation, make it much more complicated and also more risky, and also even in those low-risk operations on low-risk patients where quite a few adjustable gastric bands are done in outpatient setting in surgery centers, may benefit greatly from overnight stay where pain, sometimes severe nausea, and few other symptoms may be handled much better and followed much more closely with greatest benefit to the patients. Preoperative selection and discussion of what works by what mechanism is critical, and sometimes I tell patients that they are not necessarily best lab band candidates, even though they may be somewhat higher risk and this is a lesser risk procedure. I present the facts, and often they decide to go with operations that has better chance of success. It's probably at least 20% of patients who have perfect band in a perfect location and adjust perfectly who actually have very disappointing results in terms of weight loss, just because maladaptive eating behavior and food and poor food choices that they continue to have. Experience matters in bariatric surgery because even though most of the time it's a fairly routine operation, often enough it's not, and you encounter both anatomical difficulties as well as technical mishaps that have to be corrected properly and safely, and if they are not, they may result in a disaster. And it's something that you learn by doing hundreds and thousands of operations on all sorts of patients, dealing with all different anatomical findings. Before I started actually doing bariatric operations myself, I assisted on somewhere near 3,000 operations, working with other very experienced original bariatric surgeons. And that's how I gained experience on this huge amount of patients, both in operating room and in perioperative care. So when I did my first operation, I was already much more experienced and even recent fellowship graduates that possibly work on a couple or 300 cases through 1 or 2 year fellowship. And since then, I certainly do several hundred operations a year. Patients that you only recognize by reading your notes and seeing preoperative pictures because you don't recognize patients showing in a door of your office. It's something that's unique to bariatric surgery, and it's one of many surprising benefits that give surgeons satisfaction, in addition to elimination or correction, say, multiple comorbidities in most cases.